name is Marty Contreras. I am the owner of MA Medical Services here in San Antonio, Texas. I've got a master's in exercise science from the University of Texas, San Antonio, and I'm a prior military active duty medic. That's kind of what got me into graduate school to learn a little bit more about the human body, specifically how we respond to shock. Because I saw a lot of that on the battlefield, and I wanted to study that a little bit further. We're here today to discuss the ANS, which stands for the autonomic nervous system. When I was in graduate school, I specifically wanted to look at
ready for deep breathing after 30 seconds.
How the body responds to shock. And so during that process, the cells in the body will communicate to the brain. And it's that communication that intrigued me. Because before that, we had focused specifically on blood pressure. When someone was in shock, we focused on blood pressure, or what we call pulse pressure in the medical field. And I always felt that all the research I had done on blood pressure, that was not the answer. That the answer was definitely within the communication between the cells and the brain. And so our research focused on something called heart rate variability. And that's where you put 3 ECG leads on someone, just like Susan has here. And we were able to pick up the variability in the heartbeats. That variability explains the communication between the brain and the heart, and specifically the brain and the large nerve. And so that is a tremendous value for us in the medical field to assess your overall wellness. The ANS was developed to capture the communication between the cells and the brain, and it also includes some other pieces to the puzzle that we didn't research when I was in grad school. One is the pulse wave velocity, which it uses 2 O2 concentrator probes on the index finger and on the big toe. With that specific wave, we can see the arterial stiffness, or we can see the elasticity of the vessels, the blood vessels in your cardiovascular system. That's really important because whenever the body is trying to balance itself, it uses the heart, the brain, and the hormones in the body to create a balance so that you can go on and do the things that you normally do in life. However, just like right now, this machine's asking Susan to bear down with her stomach. So it's asking her to do a Valsalva maneuver. What that is doing is it's causing the brain to work with the cardiovascular system, and then hopefully we're not turning on the hormone system, the endocrine system. And this machine will show it if it does. If that is happening, then this individual is having trouble balancing between the brain, the heart, and the hormones. Okay, so this technology was developed around 2009, 2010. It has hit the market within the last 18 months. 18 months is about the time frame that the device has been on the market. It is FDA approved. It is currently used across the United States. It's more used in the northeastern part of the United States than it is in the southern part of the United States. San Antonio, Texas is known as the mecca for the medical world. There is a large population of individuals that have diabetes, hypertension, and so we do have a huge patient population. There are also approximately 80-85 hospitals in San Antonio. So this is a huge area for wellness. However, this tool has not reached this market, and we really need it here in San Antonio so that we can assess the patients in this population in a non-invasive way, and we can change the way that we're treating them. Okay, there is no specific certification that you need in order to run the test. However, we do provide the training to the physicians, the clinics, the groups, etc. We do offer the training to their staff so that they're able to run the test. And we also provide training on the interpretation of the results, which we'll get to later. So the ANS requires the individual to do 3 things. Well, really 4 things. One, it requires them to just sit still for a certain period of time. Typically, it's about 2 minutes. Then it'll ask them to breathe, to deep breathe. And it's a controlled breath. So the machine will tell the individual to breathe in and breathe out at a certain time interval. The third thing it'll do is it'll ask you to bear down to solicit the Valsalva maneuver, as we've seen earlier. And then the fourth thing it asks you to do is to stand up. When we're doing those 3 things, we're really asking the body to balance. Okay, we're turning on the brain to talk to the heart, to talk to the hormone system, so that we can create a balance, and so that the person can do the things that the machine's asking it to do. Here in San Antonio, there are approximately 4 clinics or practices that have the ANS currently. Across Texas, there's approximately 40, and it's growing by the day. There's a lot of individuals in Houston are starting to use it. A lot of practices in Houston starting to use it. Dallas is the predominantly largest market right now, and in San Antonio, obviously, we need to grow. Okay, the results are broad. Okay, we'll start out with the cardiovascular system. So it will give you the elasticity of your large arteries and your small arteries. It also give you the stiffness of the large arteries and the small arteries or the capillary bed. It will give us the return of the blood from the circulatory system to the heart. So that's the vein side. It'll also give us the heart rate variability. So we're able to see the actual variability between beat to beat. We're also given a full ECG. For the entire time. The test runs for 15 minutes, so you have a 15-minute ECG. It will give us a cardiac stress test, full results with cardiac output, stroke volume, and one interesting thing that it'll give you, and that is your total blood volume. Some other items that it'll give you in the cardiovascular system is it'll give you your pulse wave velocity. And so the pulse wave velocity is a real good indicator for things such as your overall cholesterol. I'm not talking about the cholesterol that you take when you go to your doctor and they draw your cholesterol level. I'm talking overall cholesterol throughout your whole body, and that's a good indicator of your hormones in your body. On the neurology side or the nerve side, it'll give us the obviously the heart rate variability. It'll give us the conduction between the cells and the brain. And on the hormone side, it'll give us if we're actually kicking on the hormones and how much hormones are inside of the bloodstream. And then it'll give us, with that in mind, it'll give us the potential for blockages throughout the body. So cholesterol builds up in your body and it can cause blockages. It'll give us that reading in throughout the body, so that way we can know early on if someone has a potential for a blockage or if they have cholesterol building up in their body. Another interesting thing it'll give you is your functional age. So your functional age is how your body is functioning, not your birth age. Your birth age could be tremendously different. We hear a lot about you can add years to your life. Well, that's what your functional age is. I'll give you an example. We've tested individuals who are 52 years old by birth, but they are 42 years old in functional age. And that's due through diet and exercise and take care of their body. Yes, there are similar technology. Some of the technologies that are being used here are obviously heart rate variability. There are numerous machines that will do heart rate variability for you, to include Polar watch that people use for exercise. Okay, so there is a lot of technology for heart rate variability. Also, you have obviously a blood pressure cuff, so that technology is widely known. And then, of course, the ECG, the 3-lead ECG. There is 2 other devices on the market that do conduct an ANS, an autonomic nervous system test similar to this. They're just a little bit different in their interpretation, i.e. they might not have a pulse wave velocity, or they might not have the same calculations with the blood pressure cuff, pulse wave velocity, and the ECG.
The test for the ANS runs between $200 and $800, and insurances are covered. Medicaid, Blue Cross Blue Shield, Aetna, all the insurances will cover it, and we have not seen any denied claims. If they want to own a machine, they can contact us at MA Medical Services. We're more than happy to bring a demonstration to their clinic, facility, organization, etc. And the cost of the machine is right around $50,000. Obviously, through the patients that they treat, if they have a practice that has 1,000 patients, they could easily pay back that investment within a short amount of time.